Looks like we have Sue from Portland. Oh my goodness, I love Portland. It is one of my very favorite places. I specifically love the wine tasting just outside of Portland in Willamette. It's my my favorite wine tasting region. So I try to get out there as much as I can. I have a really good friend in Seattle, which is not too far. So they have good wine there too. Let's see, who else do we have? We have Jerry from California. Nice to meet you. Someone from Maine, someone from Massachusetts, some more people from Chicago. Awesome. Oh, someone from Michigan. I grew up in Michigan, so always good to meet a fellow Michigander. So awesome. So as you come in, definitely feel free to drop in the comments where you're from if you'd like. It's like I said, it's just so fun to see where people are from. But we do have quite a bit to cover today. So we definitely want to make sure that we jump right into the content so we can get the most out of our time together. I also wanted to mention that if you do follow me already on Instagram or Facebook, or want to follow me on Instagram and Facebook, send me a message, #webinar, just to let me know that you're here. It's so fun to kind of connect with people after the fact, after the webinar, to just kind of see what you think and see what you learn. So definitely send me that message, #webinar, on Instagram or Facebook, whichever you prefer. If not, no big deal, but it's always fun to connect with people. All right. So I also wanted to mention there is going to be time for Q&A at the end of the webinar, and I love Q&A. It's always my favorite part, so definitely love those questions. But do wait until the end. Typically, there's quite a bit of activity in the chat, so it's impossible to kind of go through and check all of those comments. So definitely kind of wait until the end to put in those questions, and I will get to as many as I possibly can at the end of the webinar today. All right, so let's go ahead and dive in. So just to make sure that you are really the right person for this webinar, here are the people who are really going to get the most out of this webinar, and you're really in the right place if you have had a kidney stone and you are sick and tired of getting stone after stone. Maybe you've had 1, 2 stones, or maybe you've had hundreds. If you are sick and tired of those things, you are in the right place. If you're living in constant fear of getting more stones, very importantly, if you're motivated to learn and tweak your diet to prevent stones, because I'm a kidney stone dietitian, that's what this is all about, right? Also, if you're frustrated trying to figure out what to do, what to eat, and just what in the world you can do to prevent kidney stones, and you're sick and tired of getting either no or pretty much useless advice from your doctor, you're definitely going to learn a ton today. Also, if you value evidence-based strategies to prevent kidney stones, if you've been around me for very long, you know I am all about research and data, and everything that I do is backed by actual research. And lastly, but very importantly, if you believe, and I know sometimes that can be a really tall order, or if you at least want to believe that it is possible to prevent kidney stones, you are in the right place. You are not in the right place if you're just here to throw tomatoes at me. I know sometimes people, being out there on the internet, sometimes people just want to be nasty, and if that's you, this is not the right place for you. Also, if you want a quick fix, learning and changing your diet certainly takes time, patience, and willingness to learn. And so if you are here for a quick fix, this is not the right place for you. I certainly make things as easy as humanly possible, but just like anything in health and nutrition, if it seems too good to be true, then it likely is. And so if you're just here for a quick fix, this is not the right place for you. And also, if you're not open to a new approach to kidney stone prevention, a lot of my approach and strategies that I use to prevent kidney stones are a little bit different than a lot of the outdated information that tends to be out there. And so if you're not open to learning a new way, this is probably not the right place for you. Through all of this, my promise is that I will deliver as much value in this free 60-minute webinar as humanly possible, that I will teach you everything that is based in actual research and best practice. And I also promise that everything you learn here is exactly how I help people prevent kidney stones in my course, Kidney Stone Nutrition School, every single day. So in return from that promise, I ask that you really keep an open mind about the new information that you're going to learn here today, even if it is a little bit different than maybe what you've heard before. I also ask, of course, that you treat me and the other people on the webinar with respect. Again, we are, all coming together from online, and sometimes the online world can be a little bit nasty, and I try to keep all of my platforms as positive as possible. So I ask that you do the same. And I also ask that you take plenty of notes. If you have your webinar action guide, that can be a really great place to take notes, or wherever, if you have just a pen and paper, or however you like to take notes, obviously, because you really are going to learn so much amazing stuff today. And the more notes you take, you really will be able to implement what you learned today as soon as possible. So what exactly are you going to get out of the webinar today? You are going to learn three of the biggest mistakes that I see people make every single day when trying to prevent kidney stones, as well as my three-step method to preventing kidney stones. And also, as a little bit of a teaser, for those of you who are excited to really get started right away, I have a special bonus that I'm going to be talking about at the end of the course if you really want to get started and prevent stones and work with me right away and sign up for Kidney Stone Nutrition School. So definitely stay tuned and wait until the end to learn a little bit more about these pretty sweet bonuses. All right. So I find that so many people I meet in the world, I meet hundreds of people who have kidney stones these days, which is pretty phenomenal. But I find that many people really feel like this woman on the left here. They feel like they're lost and truly kind of like lost at sea in a tiny little rowboat like this, right? In a super tumultuous sea, and just have really no idea what is going on, no idea what they can do to prevent stones. They feel so confused. What should they eat calcium or not? Should they eat oxalate or not? Can they, what in the world can they eat? And truly this sort of freedom from stones, if you will, or this like feeling confident and in control of their kidney stones feels completely impossible to get to. And I promise it doesn't have to be so hard. You can be more like this woman on the right here in a calm sea with lots of really delicious, nutritious foods around you, feeling calm and confident. And that freedom from stones feels much, much more attainable. That really, really is possible to enjoy all of your favorite foods and really just enjoy life despite the fact that you have a history of kidney stones. And today on the webinar, I am sharing exactly how you can do that with my three-step method. And I will say, biased, but I think it's true, that focusing on nutrition is truly one of the best ways to prevent kidney stones. However, a kidney stone diet, whatever that means, is not enough. There is no one single kidney stone diet, and we will talk a lot more about that later today. Instead, you have to get crystal clear on what the cause of your kidney stones is, because when you are able to do that, that is really what makes all of your efforts really worth it and effective at actually preventing kidney stones. So before we get into all of that, I want to share a little bit more about me because I know some of you have worked with me. I know there's people who have taken Kidney Stone Nutrition School on the call today, but some of you maybe have not met me. And if you've just maybe met me online, I want to share a little bit more about my background so you know where you are getting your health information from. So again, my name is Melanie. I am a registered dietitian and I specialize in kidney stone prevention. I am a researcher, author, and educator in kidney stone nutrition, both patients such as yourself as well as fellow dietitians and doctors. I do a ton of public speaking to really help improve the care of people with kidney stones all across the globe. I have a master's degree in clinical nutrition from Rush University. I'm board certified in kidney nutrition, and I am a fellow of the National Kidney Foundation as well as the Academy of Nutrition Dietetics. On a more personal note, I am a huge Michigan State Spartans fan, especially football. So if there's I know there's some people from Michigan out there. So if there's ever some fellow Spartans, definitely go green. If I can go whites, that's super exciting. I also love sushi, red wine, and trying new restaurants. As I mentioned earlier, I live in Chicago, and one of my very favorite things about this city is trying new restaurants and trying new cuisines. I actually I called it an ethnic dinner club with my friends for about 6 years. We met every single month. When COVID came around, it kind of shut us down, but we met every single month for about 6 years and tried a different ethnic restaurant in the city, and it was one of my very favorite things ever, which really I feel like highlights how much I love food. And along those lines, I consider myself a foodie. Like I feel like many dietitians are dietitians just because we love to eat and love food. And that is really embedded in everything that I teach and sort of my approach to kidney stone prevention, because I truly believe that food is something to be enjoyed and something that we should get pleasure from. It is so, cultural, religious, nostalgic, right? There's so many beautiful aspects of food, and whatever thing you're doing to prevent stones, whether it be for stones or heart disease or diabetes or whatever it is, those themes have to be a part of what you're doing. And so my approach to nutrition for kidney stones really is as least restrictive as possible to really let you enjoy things like an ethnic dinner club with your friends if that's something that you do. So, a little bit more about my background and how I got started in kidney stones. If we throw back to 2017, when I was a relatively new dietitian, completely inexperienced in kidney nutrition, and I certainly knew nothing about kidney stones because most dietitians are not trained in stones. I just started a job at the University of Chicago, and I was fortunate enough to work with and learn from some of the top doctors in kidney stone prevention. So, like I said, I really didn't have any formal training in kidney stones, and I was sort of sent off to learn on my own. And even though I was insanely motivated to learn, I am a very persistent person. At the beginning, I was still a newbie, and I'm pretty embarrassed to say that starting out, I was giving some pretty generic advice to people, sort of falling along the lines of that kidney stone diet, which is kind of what a lot of the information out there is about. And I hadn't really learned how to or the importance of personalizing nutrition advice for kidney stones. And although I had learned quite a bit at this point, I think I certainly knew a lot more than most dietitians. I found that patients were still super frustrated, right? Like they still felt like they couldn't eat anything, probably because I was still spending a lot of time talking about oxalate, embarrassingly. And their lab work was kind of getting better, but not really. And they were still making stones, and I was frustrated. They were frustrated, and I really didn't feel like I was making a huge difference. And I honestly didn't enjoy working with people who had kidney stones very much. But things did get better. So as I learned more through my experience through a whole bunch of things like, preparing for research presentations and my research work at the university, I published a few papers. I realized that many of the exact opposite foods that I was recommending were shown to prevent stones again and again and again. As I really dove into the research, I learned that specifically the Mediterranean style diet, which probably most of you are familiar with, as well as a diet called the DASH diet, which is similar to the Mediterranean diet. But both of these dietary patterns are consistently shown to prevent stones. We'll talk more about that a little bit later. And this really didn't make sense since both of these diets are packed with the exact same vegetables, fruits, nuts, beans, and seeds that I was telling people to avoid simply because of their oxalate content. And by this point, I was also really beginning to understand 24-hour urine tests, which is a test that really tells us why someone is making kidney stones, which is crucial. We'll talk a lot more about that later. And based on this, I really learned how to tell them which diet change would get the biggest bang for their buck and where to really focus their efforts. And this truly was a game changer for my patients. So rather than trying to focus on a million different things, this really helped my patients focus on just a couple things that would really prevent kidney stones for them, which was obviously a lot easier for people to focus on, just a few things versus trying to do everything at once. And I found that best of all, they stopped making kidney stones, despite the fact that I stopped talking about oxalate and I was talking about sort of more of a less restricted plant-forward diet. I found that this was way more effective at stopping kidney stones for them, as well as improving those 24-hour urine tests. So really by fine-tuning and giving more personalized nutrition recommendations based on their urine risk factors, it wasn't just more effective at preventing kidney stones, it made it easier for patients. So it really was a win-win. So in addition to this fine-tune approach, the biggest change I made was to really, like I kind of mentioned, not focus on oxalate. I realized there was zero evidence to show that a low oxalate diet prevents kidney stones, and that very few of my patients had high urine oxalate to begin with. Actually, about 20% of patients with stones have high urine oxalate at all, so that's not very many. And so really by taking away this intense focus on oxalate, I found that people could really enjoy their favorite foods again. Sort of that food fear went away, which I imagine many of you are experiencing right now. And they didn't feel like they have to Google and research every single food that they ate or that they wanted to put in their mouth. And without stressing about oxalate, they felt that they could not only prevent kidney stones, but it also made kind of putting all of their other health goals, such as diabetes or high blood pressure, high cholesterol, whatever it was, it made it easier to mesh kidney stone prevention with all of these other health goals because you have one diet to eat that really needs to address everything that's going on in your life, right? And so I really found that made everything sort of come together, and people really felt like they were in control of their kidney stones. So kind of fast forward to now, I find that so often people tell me that their doctor told them that they're just a stone former or that kidney stones just run in their family, so they're sort of doomed. And this so isn't true. I'm here to tell you today that no matter who you are, there is something that you can do to prevent kidney stones. And this is really exactly why I started the Kidney Dietitian. I found this sort of new approach and deeper understanding that I had of kidney stone prevention so exciting, and it truly was life-changing for my patients. And I felt this almost ethical urge to share it with the world. And that is why I started the Kidney Dietitian in April of 2020. It was actually my COVID project, and here I am today. In addition to that, it was quite frankly heartbreaking to see my patients driving themselves crazy, following oftentimes terrible, harmful advice that they found on the internet. And that really is what drove me to start the Kidney Dietitian. So since then, I've interacted with thousands of people who have kidney stones via my blog, social media, my podcast. I imagine how many of you found me today. And I've learned how kidney stone prevention really just isn't part of care for most people. Most people will see a urologist when you have kidney stones, which is very, very important. But a urologist is a surgeon, and they're really good at getting rid of stones. And most urologists aren't trained, or at least well trained, in how to prevent kidney stones and how to stop them from coming back. And this sort of facet of kidney stone care really, really is missing, I think, from the healthcare system. And I've seen so many people end up with stone after stone, thinking they're doing the right things, focusing on oxalate or focusing just on a low sodium diet or whatever it is. And of course, there's bits of truth to all of these things. But I just find that people are spinning their wheels and focusing on either completely the wrong things or trying to do everything at once, and it just isn't very effective. And so I've found a way to really break this vicious cycle, and that is what I help people do every single day in my online course, Kidney Stone Nutrition School. So diving into those 3 mistakes that I find that people make most often when it comes to kidney stone prevention. So mistake number 1 is trying to be too strict with your diet. I will say, if you feel like there's nothing you can eat and you feel hungry all the time, you are probably doing something wrong. I find I get messages from people every single day that you feel miserable and hungry. People are trying to keep salt, protein, oxalate, sugar, whatever it is, as low as possible. And that simply is not realistic, nor necessary, or healthy. And people just honestly feel scared to eat almost anything. You know, people feel like, oh, there's nothing left to eat except cardboard. Or sometimes people say rice and iceberg lettuce, right? There's nothing left to eat. And that just so doesn't have to be the case. And that's just so heartbreaking if that is you. I also want to say that you're not alone. I think this fear comes from a very warranted place, right? You are terrified of getting another kidney stone. Obviously, that is very likely the worst pain that you have had or will have in your life. And you want to do everything possible to prevent another one. And so when you hear that, oh, salt causes kidney stones, for example, you're like, all right, I'm not going to eat any more salt. But we really need to really get a bit more balance when it comes to stone prevention to make this something that is both healthy as well as sustainable. Also, most people aren't getting personalized advice. Like I said, stone prevention is not really a part of medical care, so you're not really getting that personalized advice from your doctor. Most people you're just given a couple of handouts and you're just thrown out the door, kind of left to your own devices. And so you have nowhere to go except Google to try to figure out what you're supposed to be eating. So it's not your fault, right? This is something that I think a lot of people experience. And kidney stone nutrition is complicated, right? Like when you figure out what your personalized plan, and it's not hard, but there's a lot of things going on. And so it's really, really difficult to figure out what makes sense for you to prevent stones. And this really can't go on forever, right? Eventually, you'll burn out. You cannot do everything, quote, perfectly, whatever that means. You cannot follow a no sodium diet forever, right? Because that's not healthy. And it's just not realistic, right? Eventually, when you're sort of following the super, super strict diet, you truly are at risk of nutrition deficiencies, as well as disordered eating and fear of food. I think it also contributes to a ton of stress around celebrations, time with friends, and activities that include food, which is really heartbreaking to me. I mentioned earlier how I define myself as a foodie, and I think food we cannot ignore that very important sort of emotional aspect of eating. And when we are put on these super, super strict diets, those things just aren't feasible to do without feelings of like guilt and like, oh, I'm like giving myself a stone because I had a piece of chocolate cake, which is so not true, by the way. You can totally have chocolate cake. But that's just really heartbreaking. And also, perhaps, and we'll talk a little more about this later, people, when you are on these super strict diets, you're not eating things that are good for kidney stone prevention or general health, right? Like, I think my approach to kidney stone prevention is way more focusing on things that you can add to your diet that are going to help prevent kidney stones versus this giant list of no's and all these things that you can't eat. So I really find that a more balanced approach is a whole lot better. You should and must eat your favorite foods no matter what they are. And you can, I promise, no matter what your favorite food is. And that zero is never the goal. We're not aiming for zero added sugar. We're not aiming for zero protein or zero sodium. You're learning how to put it together in a whole meal pattern. I truly believe that all people deserve to enjoy eating and food, no matter who you are, no matter what your health history is, no matter what your body size is. All people deserve to enjoy eating food and eating, right? And everything that goes with that. And we deserve life without fear of eating. So, and I truly think that despite all of these things, the kicker is that this approach, this more balanced approach, focusing not only on things that are quote bad that you can't eat, instead focusing on things that are good that are going to actively prevent kidney stones, is going to be a whole lot more effective at preventing those kidney stones, because you will be eating those things that again can actively prevent kidney stones. Here is an email that I received from a kidney stone nutrition school student that was it's just such a beautiful note, and I asked and he said that it was okay that I shared that. Really just that working with me through the course took away that food fear. He said he really struggled with that fear of eating at the beginning. He felt like there was nothing he could eat. He was terrified that everything he put in his mouth was going to cause a stone. And through working with me, he learned that that was definitely not the case. And he also didn't have any more kidney stones, which is great too. But I just like my heart just jumped for joy when I got this email, because this is why I do what I do. I love preventing kidney stones, but I love giving people their life back, right? And being able to eat without that fear. All right, so the second mistake that I find that people make to prevent stones is getting way too bogged down in the details, especially that oxalate. So not only are we being way too restrictive, sort of along those same lines, but different, we're getting way bogged down in the details. People are panicking about every milligram of oxalate they're consuming and exactly how much calcium they have to eat to like counteract it. And like, that is not what this is about. Nutrition is not that exact of a science. I hate to bust your bubble, but it just isn't. We really should not be Googling every single thing you want to put in your mouth. If you're doing that, that is no way to live. And I'm here to tell you that it really does not have to be so hard. We should not be calculating out every single bit of sodium, protein, oxalate, sugar, calcium you want to eat. Instead, we really should be focusing on the big picture, and I promise you that is going to be way more effective and way more enjoyable. We need to be thinking about eating different food groups in the right amounts, right? Thinking about entire meal patterns and not this sort of laser focus on individual nutrients. Diving into that oxalate piece a little bit more, because I said people really, really get bogged down in oxalate. I truly believe that there is a danger to this sort of hyper focus on oxalate that most people are doing. Firstly, I want to say that accurately counting oxalate is impossible to do, and it's also completely unnecessary, which we'll talk about in a bit. But the exact amount of oxalate that you're eating, you cannot count it accurately. So this idea of following like a 50 milligram or 100 milligram oxalate diet is ridiculous, because you have no idea how much oxalate you're consuming, but that's okay. We don't need to panic about that, because oxalate really is not this devil that it's been made out to be. And the biggest issue with this low oxalate diet is you will end up avoiding all of these things that are good for stones. Like I said, my approach to stone prevention is way more about things that you can eat to actively help prevent or inhibit those kidney stones. And unfortunately, a low oxalate diet removes basically all of the things that we know will help prevent calcium, as well as uric acid stones, actually, for that matter. Magnesium, which comes in green leafy veggies, nuts, beans, and seeds, will help prevent oxalate stones. Something called phytic acid or phytate, that's found exclusively in whole grains, potatoes, and beans, is a very potent inhibitor of calcium-based stones. And also fruits and vegetables and whole food plant proteins, such as beans, nuts, seeds, especially when we eat them in place of non-dairy animal proteins, such as beef, pork, chicken, fish, seafood, etc. All of these things are going to help sort of balance or neutralize acid in your urine, which is going to help prevent most types of stones. And so this low oxalate diet is truly limiting all of these things that are truly going to be beneficial for kidney stone prevention. That's my biggest issue with it. In addition to the fact that there's literally no data that shows that a low oxalate diet will prevent stones. So instead, not saying that oxalate doesn't matter, but instead of this approach of, all right, we're gonna eat as little oxalate as possible, I think it makes a whole much more sense. And I found that it is way more effective and healthier to focus on reducing how much oxalate gets absorbed from the food that you eat, not simply how much oxalate you eat. Because like I said, that low oxalate diet is going to be lacking in things that are good for you, both from a general health standpoint as well as kidney stone prevention. And so it makes a whole lot more sense to work on reducing how much oxalate gets absorbed through that. And there's a wide variety of things that we can do to make that happen. Most notably, making sure you get in enough calcium, which feels super counterintuitive, I know, but it's true. And I find that this is a much more effective way at getting oxalate levels down. Also, I just want to note that only about 20% of people who have oxalate kidney stones have high urine oxalate in the first place. Despite, but people always assume, oh, I have oxalate stones, I shouldn't eat oxalate. Well, that's so not true. Most people are forming calcium oxalate stones because of other things going on in their urine. And so a low oxalate diet is completely missing the point. Again, kind of back to my previous point of sort of spinning your wheels and focusing on completely the wrong things. We need to know what's forming stones for you. And in the vast majority of cases, it is not high levels of oxalate in your urine. So why do people talk about oxalate all the time? I imagine that many of you have gotten an oxalate list from your doctor. In fact, go ahead and type a 1 in the comments if you've gotten a low oxalate diet handout from your doctor, and a 2 if you have not. So just let me see how many people. Yeah. All right. So most of us have gotten advice from our doctor to limit oxalate to some extent, because this is just what is out there. And unfortunately, this is just outdated advice. I will say at this point, we have plenty of data that shows that actually very high oxalate dietary patterns are consistently associated with a lower risk of stones. And there is not a shred of evidence out there that shows that a low oxalate diet prevents stones or improves any health condition for that matter. I think, kind of going back to my point before, I think a big issue is that urologists are not necessarily kidney stone prevention experts. Kidney stone prevention is not a routine part of their training. Obviously, some urologists are certainly trained and they have gone and educated themselves in this, but they are surgeons and they're good at getting rid of stones, which is very important, but they're not necessarily stone prevention experts. And doctors are definitely not nutrition experts. That's why dietitians exist, right? And so I think because of all of these things, that's why there's this pervasive low oxalate message out there everywhere, right? Online, from your doctor, all these places. And also it's counterintuitive, right? Like it's very silly. It sounds very silly for me to sit here and say like, oh, you have oxalate stones, go ahead and eat oxalate, right? That doesn't make sense. But when we look at data and think about how nutrition works and how your body works, it makes a lot of sense. Like historically, decades ago, we used to recommend a low calcium diet for people with calcium oxalate kidney stones because that made sense. You have calcium stones, you shouldn't eat calcium. But now we know that is very harmful advice. And in fact, just that one change of getting in enough calcium can actually reduce the risk of calcium oxalate stones by 50%. So like that doesn't make intuitive sense either, but we learn from research and we change our practice. And unfortunately, I think that practice just hasn't changed yet. And it's not up to date with the data that we do have that shows that really a pretty high oxalate diet is most effective at preventing stones, as long as it's well balanced, has enough calcium, and is in balance with all the other things. So I truly have found that, I know this sounds sort of hokey, but like truly I find that letting go of that oxalate, it has this massive sense of freedom and massive, like makes things so much easier for patients. People who I work with, right, students in kidney stone nutrition school are able to throw away those good and bad food lists. Like imagine not being tied to those food lists and needing to like Google it or like check your, PDF or whatever it is. Just letting go of those lists really gives people this sense of freedom and ease when it comes to eating. We are able to get rid of the stress of figuring out the exact nutrition, the exact milligrams of calcium and oxalate and sodium, protein, and everything you eat. It does not have to be so hard. And instead, it allows you to focus your time and energy on adding nourishing foods for kidney stones. Again, those foods that are actively going to prevent stones. And again, this really is actually going to be more effective at preventing kidney stones. Oops, go forward. And this is an example. This is actually a Facebook comment from Janet. She is another student in Kidney Stone Nutrition School, and this is what she said. So she said that the minute she put away her oxalate list and started eating healthy, 5 years of working after 5 years since she worked with me, no stones. Following the low oxalate diet was consuming her life and really making her not want to eat anything, which I imagine many of you can relate to. She says it took 4 hours to decide what to eat, which just is no fun. That's no way to live. That's obviously not sustainable. But throwing away that oxalate list and focusing on things that actually mattered for her resulted in no kidney stones for 5 years, which is a very long time for her because she had many, many stones prior to that. All right, so the third mistake that I find that people make most often when trying to prevent kidney stones is not focusing on what matters for you. So I'm here to say that kidney stone nutrition is different for every single person on this webinar. And kidney stone type is not enough. So oftentimes people will send me a message and say, oh, Melanie, I have calcium oxalate stones. What can I eat? And my response is, I have absolutely no idea because I don't know what's causing your calcium oxalate kidney stones or your calcium phosphate stones or your uric acid stones. There are very, very different causes for the exact same type of kidney stone. And I need to know your cause before I can know what I can do to help prevent it, right? Because if we don't know why you're forming stones, we have no idea what we can do to prevent them. Also, people are different, right? Obviously, right? We all have different nutrition goals, different things we want to work on. Maybe you also have diabetes or high blood pressure or osteoporosis or osteopenia or inflammatory bowel disease, right? There's so many different things, or allergies, whatever it is. And all of those things have to be considered when we're coming up with a plan that really makes sense for you. And perhaps most importantly, foods you like to eat, right? The foods that are central to your culture and your life and just the foods that you enjoy eating. Those are the foods that we are going to work into a plan to prevent kidney stones for you. Because again, just to really drive this point home, without knowing the cause of your stones, any efforts that you're taking to prevent them really is just a guess. And I find that this is what people are doing all the time. People are just spinning their wheels, focusing on completely the wrong things that really aren't doing a thing to prevent kidney stones for them, which obviously makes you super frustrated and you just want to give up because you keep getting kidney stones because you feel like you're doing all of these things to prevent stones, but you keep getting stone after stone after stone, which is obviously miserable and obviously makes you want to give up. Of course it does. And you guys know this way, I do not need to tell this group of people this, but stones are so much more than pain. Obviously, kidney stones have that notorious pain, but there's a significant cost of the constant ER visits and surgeries and doctor's appointments, right? You want to do everything that you can to prevent stones and avoid the pain and all of these things, but you're just exhausted because you feel like you're doing everything you can, but it's very likely because you're not focusing on the right things. Kidney stones are associated, have the potential for infection as well as kidney damage, as well as hospitalizations if things go south, right? Also, there's the emotional toll of kidney stones, which I think is something that does not get talked about nearly often enough, which is things like fear of passing a stone on vacation, fear of missing out on family weddings, or being nervous about going to a wedding and passing a stone and having to leave and and having to miss that important event, right? And all those things. And those things that really make life worth living. It's just so, it makes me so sad that people are focusing on totally the wrong things for them and spending so much time and energy focusing on things that are not going to do a thing to prevent stones for them. We really need to know what is causing your stones so we can know what we can do to prevent stones, because I promise there are things that we can do to, at the very least, reduce the risk of you forming more stones. And that personalization is really key to this story. We really need to know. When we get deep down and we know what's causing your stones, we are able to know exactly which changes you need to make to prevent kidney stones for you that will actually make a difference. Another benefit, in addition to actually preventing kidney stones, which is great, another huge benefit is that it actually makes it easier to make these changes, because it's really hard to make change. Like, making diet and lifestyle changes is no joke. Like, this is a notoriously difficult thing to do, especially in the long term. And kidney stone nutrition is a long-term game, right? And so if you know just one or two things that really matter for you, how much easier would it be to focus on just those things versus everything under the sun, versus everything that we talk about for kidney stone prevention, this is what is actually going to prevent kidney stones for you. Here's a really great quote from a kidney stone nutrition school student, Ron, and he just does such a great job of really summing up the importance of that 24-hour urine test analysis. He says, if anyone wants to guess and fumble when it comes to their kidney stone formation, have at it. But that 24-hour urine test, which I'll talk about soon, really is the gold standard. This is what's going to tell us why we're forming stones. And that's great to get the test, but at that point, you really need a professional to interpret the results. Like I said, many doctors are really good at being surgeons, they're good at being doctors, and maybe even good at stone prevention, but they're not dietitians who are the only healthcare professional that have that nutrition training. And so you really need to have a dietitian who understands that urine test to tell you what to do as a result of it. And he's saying that is what he got out of Kidney Stone Nutrition School and working with me. So here is my 3-step method to help you prevent kidney stones and help you not to stop you from making those 3 big mistakes that I see people making again and again and again. So my 3-step method is really to identify your urine risk factors, which again is that cause of your kidney stones, prioritize your nutrition goals, and integrate that into your life, the foods you love, as well as your other nutrition goals. So we're going to walk through each of these steps and help you understand exactly how I help people prevent stones with this 3-step method. So like I said, step number 1 is to really identify your urine risk factors, which is the cause of your kidney stone. There are many different potential causes for the exact same type of stone. So some people out on this webinar today are likely forming calcium oxalate stones because they have too much calcium in their urine. Some people might be forming stones because they just don't have enough urine. Some people might be forming stones because you don't have enough citrate, right? There's so many different things that could be going on. Chances are you have maybe 2 or 3 of these risk factors for stones, but chances are very low that you have all of these risk factors. I'm not sure I've ever seen anyone who has all of these risk factors. And so when we're able to identify exactly what's causing your stones, we can take that information and put together a personalized kidney stone prevention plan for you, focused on exactly why you are making stones. So like I said previously, again, there's no one kidney stone diet. This notion that there's this kidney stone diet that works for everyone is ridiculous, because not only are there different types of kidney stones, obviously, right? Like there's different, calcium oxalate, calcium phosphate, uric acid, whatever it is. They're different causes for the exact same type of stone. And also, as I hinted at before, people are different. People have different goals, like different foods, have different past medical histories, right? Like they eat differently, right? And that's why it's so important to, to really work with you and your diet and your risk factors to put together a plan that actually works for you. So how do you know what is causing your stones? And that is where that 24-hour urine test really comes into play. This is the only way to know how to prevent stones moving forward. It provides invaluable information about what you are eating now, and we should all be getting them annually, at least if you've had more than 1 stone. This is what the official guidelines that your doctor should be reading for how to prevent stones say from the American Urological Association. We should all be getting this 24-hour urine test at least annually, and this is something that your doctor needs to order for you. Just so you know. And if you don't have a urine test, you can, I have some tips to ask your doctor for this test, which actually I'll put it in the comments. My assistant can do that. Yes. A link to some of my talking tips, essentially to help you have this conversation with your doctor to get this test, because it is something that your doctor has to order for you. So despite this test being so darn important, only about 10% of people with kidney stones will get a 24-hour urine test once, like at any point in their life, which is astonishing. And I could probably talk for hours about why I think that is. But I think it really kind of comes down to the fact that urologists are surgeons, not kidney doctors, and they're not necessarily kidney stone prevention experts. And again, they're not trained in nutrition, which is why dietitians exist. So I feel like that this statistic that only about 10% of people with kidney stones get a 24-hour urine test is so telling, and really, really feeds into this statistic that you unfortunately have a 75% chance of forming another kidney stone But this is in the current state of preventative care people with kidney stones, which is not really great, right? We know that people aren't getting 24-hour urine tests. People are not working with kidney stone dietitians. People are not working with kidney stone prevention experts really in any capacity. Very, very, very few are. And so I really don't think that you have to be part of that 75%. Imagine on a, big public health scale, imagine how much lower that 75% would be if people actually got the testing they needed to understand what's causing their stones and they got targeted advice to prevent stones. I cannot venture a guess for how much lower that percentage would be, but I would be willing to bet it would be quite a bit lower if people even got the testing, and even better, of course, got that expert advice as a result of those tests. Here's another quote from another Kidney Stone Nutrition School student, Karen, who really, kind of summed up how interesting it was to look at her lab values and understand more about her kidney issues. Before taking my course, she felt helpless, tied to a strict list of don't eats from the doctor. And my course helped her have the freedom to branch out with more foods and just understand nutrition better. She felt that the course filled a much needed gap between the doctor and the patient. So I wanted to share that to show really how powerful getting deep into those personalized risk factors can be. All right, so step number 2 of my 3-step method is to really prioritize your nutrition goals. You can't and you don't need to do everything. So again, without that urine test and without personalized advice, you have no idea which changes will prevent stones for you. I find that people are really focused on all of the wrong nutrition changes because they don't even know what that urine risk factor is, right? They haven't identified that urine risk factor. So we really can have no idea which nutrition changes are going to make a difference for you. But once we know which nutrition changes are actually going to make a difference for you, it allows you to focus your time and energy on things that will actually matter. And you will end up being more successful in your efforts because you're focusing on things that actually matter, which means you are not going to get more kidney stones, right? Here are 3 more students that from Kidney Stone Nutrition School that really found that focusing on what mattered made them not form stones, right? So here we have Amy. She said finally after 15 kidney stones, something finally made sense, and it's helped her change the way she eats and avoid stones. Here's a quote from Jim. He says his dietary advice works. He's been stone-free for 2+ years. And here's another student that said that after working with me, his 24-hour urine test was spot on, and neither ultrasound or x-ray showed any sign of kidney stones. So I share these with you really to show you that there is hope, that there is a way to prevent kidney stones. All right, so step number 3 in my 3-step method is to really integrate all of this into your life, your foods that you love to eat, and your nutrition goals. You really can do this. I think that Googling it just isn't helpful, right? How often are you just given a handout by your doctor and sent away on your merry way, or worse, you're told to just Google it? I think that's unfortunately the state of things. I imagine many of us have had that experience. Not to, shame doctors. That's obviously not why I'm here. But I think that doctors don't have the time, right? The healthcare system, unfortunately, doesn't allow a ton of time, especially for preventative care. And our doctors just don't have time to do this. Or the training or expertise. They're not dietitians. They don't have the time and expertise to really help you incorporate this into your life and really be successful. Like knowing what to do is one thing, but knowing how to incorporate it or integrate it, if you will, into your life really is a completely different thing. Again, knowing is not enough. You have to know how to make the changes. All right, I need to eat less salt, but how do I do that? What do I eat, right? That is critical for you to be set up for success. You need to know how to incorporate this into your life, the foods you love, your eating style, and how to balance that with your other nutrition goals. Here's some quotes from previous students that really, I think, kind of sum this up. So one student says that Melanie is a very caring person with so much knowledge and has the bigger picture of not having more stones, being healthy, happy, and enjoying life in mind. I love this quote so much because I think That's my goal, right? Like I'm all about preventing stones, and that's great, but I really, really want to help you live a happier, healthier, stress-free, stone-free life. Here's another student who said that her other dietitian led me to kidney stone nutrition school, which I think really highlights, that's great that dietitian acknowledged, like, oh, I don't really know much about stones. We need an expert in this area. And she said that it was the best investment in her health she ever made, and it really changed her life. So those are such great quotes, and just needed to share them. All right. So in summary, in review, we've covered a lot today. So I wanted to kind of put it all together for you. So we've covered the 3 mistakes that people make most often to prevent stones. People often are trying to be way too strict with their diet and getting way too bogged down in the details and really not focusing on what matters for them. My 3-step method is the remedy to those mistakes. And instead of just kind of floundering and you're, like that person in the tumultuous sea that I showed at the beginning, instead, we really need to get crystal clear on what matters for you. And we do that by identifying your urine risk factors, which really is the cause of your kidney stones, prioritizing the nutrition goals that are actually going to matter for you, and integrating that into your life, the foods you love, as well as your other nutrition goals. I also want to say that this method is not just a bunch of theory and things that I've made up. It has been tested and proven to work by hundreds of my students. In fact, I presented data at a conference that 96% of my students had normal urine chemistry for at least one type of kidney stone after taking my course. So this is actually proven to work. I promise there are things you can do to prevent kidney stones. So if you take away one thing today, I want you to know that you can prevent kidney stones without taking away all of your favorite foods, enjoying life, and the endless list of good and bad foods from your doctor. And I've developed this 3-step method that makes it easy to prevent kidney stones with a personalized approach. And I've outlined exactly how I do that for you today. So I think the big question is, how can you apply this method to your own life and prevent kidney stones? And I really think there's kind of 2 choices here. You can follow a super strict diet, feel restricted and hungry and confused, and really trying to figure everything out by yourself, which you probably could do, but it's really difficult to do to really get that expert interpretation of your urine test. Or you can get crystal clear on exactly what you can do to feel confident in your food choices, enjoy eating, and give yourself the best chance at preventing more stones. And so with that, I would like to announce that enrollment for Kidney Stone Nutrition School is now open. I've opened the cart just for you guys here on the webinar today. And this really is your way to get a personalized plan and support that you need to prevent kidney stones. So next, I'll give you kind of a bird's eye view of what you learn in each week of Kidney Stone Nutrition School. So it's a 6-week course. All of the lessons are recorded and available for you to watch whenever it works for you. In week 1, we really kind of dive into the science of kidney stones and understanding your lab results. So really understanding what your urine test is telling you, understanding just a little bit of the chemistry behind kidney stone formation, as well as sort of a step-by-step review of your test so you know exactly what is causing your stones, identifying that the urine risk factors. There's tons of worksheets to really help you work through this and really apply what you're learning to your urine test, as well as example meal plans and recipes, which are included in every single week of the course, because people love meal plans, right, to kind of get an idea of just a general example, right, of how this might actually look in terms of the food on your plate. In week 2, we're really going to dive into nutrition and kidney stones. Week 2 is like the best really meat and potatoes of the week. And I really give a full review of fluid, calcium, sodium, protein, fruits and vegetables, added sugar, oxalate, citrate, and all the other nutrients that are relevant to kidney stones. So in week 1, you've identified exactly what your risk factors are and which of these things matter for you. So then you can go exactly to the lesson that you've identified that matters for you to know how to work on lowering sodium or lowering protein and which types of protein matter and those types of things. And so you'll understand how these things impact kidney stones and exactly how to change your diet. Again, there's worksheets and example meal plans and everything that you need to really help incorporate this into your life. Week 3 is how to meal plan and eat at restaurants. So really helping you learn how to build that entire meal pattern, because like I said, that is really what matters versus the individual nutrients generally, and how to incorporate your favorite foods, how to read nutrition labels, as well as my tips on snacking, restaurants, and eating on the go. Week 4 is kidney stone culinary school, which is how to modify your favorite recipes. Like I said, I'm all about eating your favorite foods. So I'm going to teach you how to change your favorite recipes to make them a bit more kidney stone friendly, as well as tips for adding flavor, calcium, extra fruits and vegetables, cooking methods, desserts, managing multiple meal preferences in a family, cooking demos, kind of everything you need to kind of flesh out how to actually cook for kidney stones. And then week 5 is healthy eating for other health conditions with kidney stones. So really how to mesh kidney stone nutrition with other common conditions such as diabetes, heart disease, high cholesterol, kidney disease, and so many more. I also talk about vegetarians and vegans because many people say, oh, do I have to be vegetarian or can I be vegetarian? And the answer is yes. Either way, you do not have to be vegetarian, but if you want to be, you can be. So my kind of tips for how to put all of this together without eating meat. And then week 6 is really how to get started. So motivation and goal setting. So really how to work through setting realistic goals that will actually work and how to keep this motivation going. So if that all sounds good to you, I also want to announce that I have some very special bonuses as a thank you for joining me on this webinar today that do expire in 4 days from now. You are going to get 30% off the course, Kidney Stone Nutrition School, as well as lifetime access to the course, including all future updates that I make. Because I said science is super important to me, and I do update the course pretty regularly as data changes, just with the most cutting edge information about kidney stone prevention. So you are going to get lifetime access, including all of those updates, which is a huge bonus. You're also going to get lifetime access to the course community. So Kidney Stone Nutrition School comes with a course community with me and other students. And if you join in the next 4 days, you're going to get access to that course forever. So this is not meant to be just kind of a course that you take and you're done. Like I've really built this to be a resource for you for the rest of your life with these bonuses because, things happen, life changes, diets change. And so this is a really great way for you to be able to go back to the lessons as well as come back to the community and check things out with me and learn from other students, which is really a really wonderful thing. I have two different levels of enrollment for Kidney Stone Nutrition School. Everything that I've talked about so far is included in sort of the base level enrollment, but you could also join as a VIP if you want a little bit more direct help from me, because VIPs get monthly Q&A live sessions with me. If you join today, you're going to get 3 months, so 3 calls with me and other students, completely free as part of this bonus. And you also have the opportunity to submit your urine test directly to me for written feedback, which is huge, again, for free if you join at the VIP level. Even better, if you join in the next 15 minutes, you're going to get access to my bonus course, which is Living with Kidney Stones. And so this is a little bit more about sort of the mental health piece of living with kidney stones. I mentioned before, kidney stones are not just kidney stones. Kidney stones impact so many different aspects of your life. And so this is kind of all the extra stuff that I really wished everyone with kidney stones knew in terms of how to manage that mental health piece of living with kidney stones, as well as managing the healthcare system and all of the members of your healthcare team and those types of things. So you can get started today with all of these bonuses, which really is about a $5,000 value for just $385, including 30% off the usual price of the course, as well as all of these bonuses, including that fast-acting bonus if you join in the next 15 minutes of that extra bonus course. If you join as a VIP, you can get in today and the next 4 days only for $560, which is about an $8,000 value. Here is one more review from the course, a message from a student who said that she just left her appointment with her nephrologist and urologist, and not only had she reversed kidney disease, this woman also had kidney disease, but she found that she had no stones. For the first time in 18 years, she'd been kidney stone free at a 3-month checkup, and it felt so good. And I just want to say that this can be you, right? This is not just a one-off thing. This has been proven to work for hundreds of people. Here are some more messages and reviews that I've received from people reporting that they have no more kidney stones. So I really think that the question isn't if you can prevent stones. I think it's been pretty proven that you can, at the very least, reduce the risk of forming more stones. I think the question is, how many more will you have to get before you decide to actually do something about it? And so, if you join again in the next 15 minutes, here's our little timer here. You're going to get this extra bonus of living with kidney stones. And if you join in the next 4 days, you're going to get access to all of these sweet bonuses, including lifetime access to the course and the community. And if you join as a VIP, you're going to get that ability to submit your urine test to me, as well as those 3 monthly Q&A sessions. So with that, I will go ahead and open up the floor for questions. I can already see that the questions are pouring in. So I will, like I said, I will get to as many of these as I possibly can. All right, let's see here. Let me scan through here. There's so many. I wish that I could do all of these. Let me take a quick sip of water. All right, so a question from Sue. Do you take insurance? I do not. I do not bill insurance directly, but I will say that for the course, I find that nearly all HSA and FSA funds do cover the course. Obviously, you have to look at your specific plan and make sure that because that could be different plan to plan. But I think it's pretty consistent in my experience that HSA and FSA plans will cover a course, especially when it is administered by a registered dietitian. I will say this is the only course available from a registered dietitian for kidney stone prevention. So yes, I think generally that is a way that you can use your insurance benefits. Let's see. More questions. All right. Tim says, what if I don't have calcium oxalate stones? That's a great question, Tim. I get that one a lot. And the answer is, no matter what kind of stone you have, this course will work for you, essentially, because the course I'm not teaching you to eat based on the type of stone that you have. I'm teaching you to eat based on your urine risk factors, right? Another reason why this notion of one kidney stone diet doesn't work and it's so silly is that people often change the type of stones that they make based on your age, right? Like it's very common for like women, especially, to form calcium phosphate stones when they're younger. And then post-menopause, it might switch to calcium oxalate stones. And so if we were focusing on prevention of the type of stone that you already made, like that doesn't make any sense, right? So we are looking at your urine risk factors to reduce the risk of stones for you moving forward. So I will say the one type of stone that this course is not the best for is struvite stones, which are super rare, but only because struvite stones they're basically completely related to infection, and nutrition doesn't really have a lot to do with that. But if you form calcium phosphate, calcium oxalate, or uric acid stones, or even cysteine stones, this is a really, really great course for you, and everything that you learn in here would be relevant for you. Yeah. All right, let's see. All right, so Rosette says, will it work if I don't eat dairy? Yes, yes. So, I get this question a lot because in my content online, I talk about dairy often because I think it's a very easy, straightforward way to get in calcium. However, I fully understand that not everyone consumes dairy for a wide variety of reasons, and that's totally fine. And in the course, I absolutely sort of detail out exactly what you can do to get calcium, and you do not have to eat dairy at all. Absolutely not. All right. Let's see. Mark is saying, Mark's saying his doctor won't order a urine test. Yeah, that is a tricky one. I think that's tough, right? I think honestly, what I want to say is you got to get a new doctor. But because if your doctor is if you are coming to your doctor and you're saying like, "Hey, doc, like I want to actively make my diet better and prevent stones," and they're saying, "No, you can't do it," like that's a red flag for me. That makes me a little nervous. But realistically, I do have some talking tips to ask your doctor for this test because I understand that's kind of an awkward conversation, right? Like you're like, "Hey, I talked to this random girl online. She says I need this test," and I get that that's kind of weird. And so I have a wonderful document to help you learn a little bit more about this test, exactly what you do, what it needs to measure, and those types of things. Also, a lot of times people ask what needs to be on it. If you're in the United States, I highly recommend going through a company called Litholink. They do the vast majority of urine testing. It actually was started by one of the doctors that I worked with at the University of Chicago. And it's really easy. Like they literally like send the collection kit to your house. You collect your urine and you can drop it off at FedEx even. You like shake it up and you send back a little sample. So that is definitely the best way to go about it. If you are going to get one, is Litholink. But Mark, I digress. But Mark, I would say if your doctor truly refuses, despite you asking multiple times, get a new doctor. Truly, if I have to be quite frank, if you have that ability, sometimes it's a privilege to be able to get a new doctor. But I do hopefully that document will help you be able to go into that conversation with your doctor a little bit more confidently. Hopefully that helps. All right. Jerry is asking, what if I also have osteoporosis? Great question. And that is why I talk about in week 5 how to incorporate things that we talk about for kidney stone prevention generally into healthy eating for other health conditions, including osteoporosis. And that's actually a very, very common question because people who have calcium-based kidney stones actually are at much higher risk of bone disease. So things like osteoporosis or osteopenia. And so in my view, kidney stone nutrition has to address bone health. And so I think that is actually great. I think everything that we learn in the course would be relevant for you to help with osteoporosis for sure. All right. Nancy is saying, can I wait to join? So the course is only available to join for you in the next 4 days. So you can wait. It will open up again at some point. I'm not exactly sure when. So you can, but if you're at all interested, I would definitely consider joining in the next 4 days because after that, the cart will close. All right. Oh no, Marcy's saying, "Oh, Marcy, so good to see you. So glad to hear that you're doing well." She's saying that she took the course a couple years ago and she hasn't had any more stones. So that's great. Thanks, Marcy. All right. Debbie asks, what about my thoughts on supplements? There's so many stone supplements out there, right? And I think most of them are not really backed by much data, so I'm not generally a huge fan of supplements. And general, I think supplements are kind of a red flag when it comes to kidney stone prevention because many of them can actually make kidney stones worse. So definitely be wary of supplements if you have stones. But when it comes to the stone prevention supplements, I think it really depends on your urine test. I think some of them can be helpful, but only if we know what's going on in your urine test. Some of them could actually be harmful depending on your urine test. And so I think it really needs to be individual. I think this notion of like these certain supplements that helps everyone prevent stones is bonkers because as I covered today, right, kidney stones are so different for every single person. So yeah, hopefully that helps a little bit. Basically, look at your urine test and talk with a doctor, dietitian who knows what they're doing. All right, Susan's asking, what's the difference between VIP and regular enrollment? And really the only difference between the regular and VIP enrollment are these bonuses that you're getting. And with VIP, you're getting a little bit more of a hands-on help from me. So everyone does have access to me in that online community, right? Because you're going to have access to that lifetime access if you join in the next 4 days to that to the course community with me. But if you want that extra help from me with that urine test feedback, so that written feedback from me, as well as those monthly Q&A sessions, which really are so great, by the way. Like, there's so much fun to just kind of connect with people and learn from each other, and learn from me, but really learn from each other. Like, there's such fun calls. Then the difference is really the ability to work directly with me on those calls as well as that urine test. That is the difference between sort of our basic enrollment versus that VIP. So hopefully that helps. Let's see. Kathy is saying, have you worked with people who have MSK? And yes, Kathy, absolutely. I've worked with many people who have MSK. For people who don't know, MSK is something called medullary sponge kidney or medullary sponge disease. It's a genetic condition that basically makes stones way more likely to form for people. And oftentimes people with MSK have many stones. And to Kathy, yes, I have absolutely worked with people who have MSK. Some people we've been able to completely stop stones, which is wonderful. Others we've been able to at least slow them, right? So maybe people were getting, 10 stones a year and we were able to reduce it to like 2, right? Or having 5 surgeries a year and we were able to reduce it to like 1. So the answer is yes. Just because you have MSK is no reason that we can't at least reduce the risk of forming stones. Absolutely. Let's see. John is asking, is lemon juice okay? Oh gosh, that is such a big question. I have a ton of podcast episodes about this, so if you want to go back, I will. And in fact, if my assistant could drop a link to one of my lemon juice podcast episodes, that would be great. But I think It's not my favorite. So lemon juice is so popular because it has citrate in it, and like low citrate is a concern for some people, but not everyone. Not everyone with stones has low citrate. And I think there's much better ways to go about getting that citrate up. Most notably, eating lots of fruits and vegetables, as well as not eating a lot of protein. But we can talk more about that. Definitely cover that in the course. So I think lemon juice is fine if it helps you drink more water. But this whole notion of like everyone should be putting lemon juice in your water is just so silly. Plus, the other thing is, in order to really make a difference in how much citrate actually ends up in your urine, you need to be drinking like a lot of lemon juice, like a quarter to a half a cup, which is a ton and a whole lot more than most people are drinking. So I think it's fine, but we really have to know again what's going on in your urine to know what's best for you. All right, let's see. Linda is asking, are beans okay? Yes, beans are demonized because they have oxalate, but really, beans are packed with all of those really potent stone inhibitors, things like fiber, actually, which we didn't even talk about today, but fiber is a whole nother wonderful thing when it comes to stone prevention, as well as magnesium and phytate, like all these things. Yes, they have oxalate in them, so we just have to learn how to incorporate them in a healthy, well-balanced diet, and beans are a wonderful option for people with kidney stones. Yes, they are okay. Hopefully that's good news. All right, so Julie is asking, how does the urine feedback work? Great question. So the urine feedback is included again for people who join as a VIP. And when you do that, you immediately get a link to send me your urine test. So it's like a bit super basic form. You can upload your urine test in a secure HIPAA form, HIPAA certified form, and you are able to I also asked you some basic questions about your medical history and those types of things, so I can kind of give you the best feedback possible. And from there, I'll send you a nice little handout of like things that I think that maybe you should focus on. I'll be like, oh, like maybe you should focus a little bit more on the sodium thing, or like maybe you need to do this. So that is how that feedback works. Hopefully that helps. All right. Well, looks like we are definitely over our time, so I will have to stop here. But as always, there are so many wonderful questions, and I wish that I had time to get to them all. But thank you so much for joining me. I know